actual webinar. All right, well, welcome everyone who's tuning in. We're really excited to be here today. If you're tuning in, I'm also joining Dr. Bendikson on Instagram Live. We'll be videoing this webinar too. We have a lot of great content for everyone today, so I'm really excited to be joined with such an incredible professional. I'm going to share my screen in a second. Thank you for joining, Dr. Bendikson.
I'm so happy to be here. Thanks for having me.
Fantastic. I'm not sure if you accepted my joining of you on the Instagram Live. So
See
maybe
if we can
just,
get the Instagram live going
oh,
so it's not a one-sided conversation here.
all right. I think that worked. So that is perfect. We're live everywhere. And with that, I'm going to go ahead and share my screen. We have some really great content to go along with our conversation today. So hopefully everyone can see us and see my screen. And we'll send this all out afterwards so you have the full video. I am Angela. I'm the founder of a company called Sunfish that helps navigate the IVF journey alongside great IVF clinics. So I'll talk a little bit more about what we do in a second. Just some housekeeping to get us started. You'll automatically be on mute and you can chat us questions anonymously through the chat function at the bottom of your screen. We'll have plenty of time for your questions at the end, as well as some special offers, discounts at that we'll share at the end of this as well. So just jump in if you have questions. A little bit about me, and then I'll introduce our fabulous physician as well. My background is in biology and business. I previously was a director at one of the largest fertility companies and was really frustrated to see how difficult it was for my patients to afford building their family through IVF and assisted reproduction. So my team and I started Sunfish to help make the IVF process easier. We offer full support throughout the process, including financial guidance, discounts, handling payments, and supporting you through every step of the process. In order to make this a really great experience, though, we need to work with incredible physicians. And we Sunfish only work with select clinics throughout the country. We're really excited to announce that as of a few weeks ago, we now work with Kindbody Los Angeles. And we're joined here today by Dr. Kristin Bendikson, who's one of the leading physicians at Kindbody Los Angeles. She has an incredible background. She's a Los Angeles native. She previously ran the patient education committee at ASRM, which is the Assisted Reproductive Society here in the US. And she's been a physician for many years at Kindbody Los Angeles and was even ranked as one of the top doctors by Los Angeles Magazine. So she brings a wealth of information and is here to share a little bit about Kindbody, our program, and the IVF process. So first, why don't I pass it to you if you want to introduce yourself further and talk a little bit about your clinic?
Oh, amazing. Well, we're so happy to um, have you here today, Angela, and also to have be partnering with Sunfish and having LA be our first pilot site. So super excited about that. I am one of the chief medical officers here at Kindbody. And so I have the pleasure and honor of not only serving patients in Los Angeles, but I am also getting to help shape the clinical future of Kindbody as a whole. And that is such a wonderful experience for me to be able to touch patients and families not just in LA, but all over the country. And I was so excited to join Kindbody. I joined in 2021, and it's been an incredible opportunity because Kindbody is such a unique fertility services center, and that's because of a multitude of things. And I think that one of the things is that we're really trying to look at the fertility experience and make it better, right? How can we do that? And so looking at it with a fresh set of eyes, and not trying to be kind of the best standard fertility clinic? Like, how can we really revamp, reimagine what that experience looks like as a patient? And so you can see this is actually a picture of our LA clinic. And so it starts with the basics and the aesthetics of our clinics. And so they're really meant to be put in areas where, it's not tucked away in some medical center. It's out in the open. It is so inviting to come into these clinics. Like you can kind of see a little bit into the waiting room. And actually, behind me is a picture of one of our waiting rooms, and this is what it looks like inside. So it doesn't feel like your typical doctor's office. It feels really warm and supportive. This is what the exam rooms look like. This is even what our procedure room has art on the walls. It's really just made to make it feel a comfortable experience. As I walk around the clinics, the doctors, we're not wearing white coats. We're sitting down. We have exam rooms set up so that patients can sit in different chairs or benches, whatever makes them feel comfortable. And so, if we can increase and access care to people because people feel more comfortable walking into the clinic, that's really, really important for us. And we know that throughout the fertility journey, for some people, there's only a couple of visits, but for many people, the fertility journey might last months, right? And years. And so if you're coming back over and over again, we want to make you as comfortable as possible. We also really want to personalize that experience. And so everyone does get treated really, truly as an individual. We have designed like a patient portal that we have on our own that is really designed to just, again, not feel like your typical portal that I think we're so used to with doctors' offices, and really supporting that communication between the patients and the team. And, I think part of it is also our approach to what we do, and that we are really trying to be nimble and change all the time. I had a patient that messaged me about how she was seeing something in her portal. And I was like, oh, wait, I didn't know that that's how you saw it, because I can't see every aspect of what a patient sees. And we changed it by the next day. And so just really unique in that we can be so nimble, and we've designed the company that way that we can like make changes very quickly to respond to patients' feedback as they're kind of going through the process. And yes, I think, one of the things that is really cool is that we are really flexible. I know in LA, I see patients at night. I'm busy. I'm a doctor. I can't get doctor's appointments, right? So I can't go. And I know, Angela, you're busy. Like when was the last time you're like, oh my God, it's been like 2 years since I've been to the dentist. Okay, shush, don't
Yeah.
tell anyone, don't tell my dentist that. But,
Yeah.
it's like you can't get there because you're super busy during the day. And so that's why it's so important to have appointments at night. And I have appointments on the weekends, and really just have text enabling so that patients can get a hold of me whenever they need to get a hold of me. Um, and the other thing that we do at Kindbody that is really unique is that we are actually a benefit provider in addition to providing the fertility care. And so we provide fertility insurance through companies that we specifically work with. And that is so incredible because we are providing fertility insurance for people who could otherwise not afford the treatments, for people that work at companies like Walmart and Tesla um,
Hmm.
and SpaceX. And so there are lots of different companies that we work with, but we don't work with every employer. Right. And so this is where Sunfish comes in. And what you guys are doing is so incredible, is that we are not everywhere. All right. And I love what we do, but when we're not there, we need to help those patients that are going through and make sure that they have access to kind of competitive pricing and have that really best in class care coupled with financial accessibility. And so that's why I am just so thrilled to be working with you and your team.
Thank you. Well, we're really excited to work with you too. That was a fantastic overview, and I will say we've met with and worked with many clinics. Kindbody has really tried to rethink the whole patient experience, as you explained, make it really modern, make it fit with people's lifestyle. And every single person I've met at the Kindbody team cares so deeply about that mission and about really showing up for patients. So you can see that in a lot of the things that Dr. Bendikson has said, but it's a really incredible organizations. So, with that, we'll share a little bit about how you can learn more, but we do want to talk about financial access and just helping you get started. So, we are going to share a little bit about fertility testing 101. If you are considering IVF, if you're considering an alternative fertility journey, I'm really delighted to have Dr. Bendikson explain some of the key questions that often come up as people are starting this journey. And then I will talk a little bit about the IVF Success Program and how we can help financially as well as from a full service support perspective. So, back over to you just to share a bit about fertility statistics and fertility testing.
Wonderful. Um, I don't think that people realize how common infertility is. And so, you know, I can guarantee anyone that is listening that you know someone that has infertility or is struggling, or you will know. Maybe you're on the younger side, you haven't got there yet, you haven't had friends that have tried, but you will. And that's because, up to maybe 1 in 5 couples has infertility. And I think that we spend so much of our lives um trying not to get pregnant, right? And so, you are so afraid to get not get pregnant when you aren't ready, that all of a sudden, when you are ready, you just assume it's going to happen. And I just had a consultation with a young woman yesterday who's trying to think about when she's going to try. And she was so shocked when I was giving her the numbers that at her age, was about like a 16, 17% chance of getting pregnant per month. And 20% is great, but that's really for someone in their early 20s. And that number starts going down. And that's just like when you first start trying. And so it's not automatic. And that number doesn't stay consistent over time. It will go down. And so the longer you've been trying, the less likely it is that you are going to be able to get pregnant. And after a year, about 85% of couples will be pregnant, but 15% won't be. And so, I think people always are asking, like, when do I need to see someone? When is the appropriate time to see a fertility specialist? And my honest answer is anytime. Whenever you are ready, if you have questions about when you want to build your family and how you should, that is the time to go see someone. And I think actually, probably for a lot of people, they aren't thinking about, when they're going to be starting their family and how many kids, and they should be, right? And so I think it's never too early. A fertility specialist is always an incredible resource to talk to you about optimizing your chances of getting pregnant, handling or managing any medical issues that could potentially make it harder for you to get pregnant. Um, and really just talking to you about what your hopes and dreams are. And is that you want one child? Is it that you want 4 children? How old are you now? How old are you going to be when you're having your first child? Those are really important questions because they may change what we might recommend for you in terms of, if you want 4 kids, you're 35 and you don't think you want to start trying until you're 39. I can tell you, if you are going to be trying on your own, is it feasible that you're going to have 4 children on your own? Yes, it's entirely possible, but it's probably going to be difficult. And so maybe you need to be thinking about fertility preservation, whether that's in the form of egg freezing or embryo freezing. If you've actually already started trying, right? And for it's not working for whatever reason, and maybe you're not sure why it's not working. The guidelines are, if you're under the age of 35, that you can wait up to a year. But that's because, again, 85% of couples in that age group are going to be pregnant in 1 year. And so most people, given time, will get pregnant. And it's just a small percentage that won't. Um, I don't think it's a bad thing to check in earlier and have testing done earlier, even if that is just enough to give you the confidence to say, hey, right, everything's fine. Like, I can try for 6 more months, and there's a decent chance that it might work. And if it doesn't, then I know I have a connection already with a fertility specialist and I can jump right into treatments. When women are older, right, and they're 35 or older, we recommend really seeing someone and starting treatment at 35. Again, that goes back to we want to get you pregnant as quickly as possible because we know if you want two children, if we're getting you pregnant at 35, in order to have a healthy pregnancy, you should really wait till your baby's at least one before you start getting pregnant again. So if you were 35 when you got pregnant the first time, you're 36 when you deliver, and you're going to be 37, right? When you are actually trying to get pregnant for that second time. And so because of that, that's why we are just constantly thinking ahead of like the sooner that we can get you pregnant this time, the better it is for your next pregnancy. Oh, and fertility testing. What fertility tests are done? I mean, there
Yeah,
are so many. If you're looking,
these are just, I think that was a really great overview. And I know that you and I both get so many questions about like, okay, great, I want to get started. So what can I
hmm
actually test?
hmm Yeah, and I think big picture. So, like, if you look at like buckets of what you have to test when a couple is not getting pregnant, you have to think about the male side. And so, on the male side, it's more straightforward, right? Men are producing sperm all the time. There's, in general, an unlimited supply of sperm. So we tend to start out with a semen analysis, which is really just a test of the number of sperm, how well they're moving, and the shape of the sperm, which can help inform us, can the sperm get up to the egg? And then once it's there at the egg, can it actually bind and get into the egg? All right. Now, there are some additional tests that we may or may not recommend depending on a patient's situation. So there's something called the sperm QT, which is a really great way of trying to understand if the sperm can really bind and get into the egg. And so it's really wonderful for those couples that are trying to decide between IUI and IVF because it could tell them that IUI is not going to be such a great option because an IUI can help get a sperm up to an egg, but it's not going to help the sperm bind to the egg. And then there's something called sperm DNA fragmentation, which is a measure of DNA damage in the sperm. And so those type of tests are really going to be tailor made very specifically for a couple. On the female side, we have to check the uterus and the fallopian tube. So those are the two portions of female reproduction that don't change with age. All right. So the uterus, for the most part, can carry a pregnancy, not have any aging issues, and the uterus will be just fine all the way up to the point where a woman's in her early 50s. Once the woman is in the early 50s, remember the uterus is a muscle and muscles age. Just we feel that all the time in our own muscles, and even like our heart is a muscle. And so those muscles change. And so there are more pregnancy complications after the age of 50. But really, up until then, the uterus is the same. The fallopian tubes don't age, but you do need to just make sure they're functioning normally. So there's different tests you can do. There's a dye test, there's water ultrasounds, there's regular ultrasounds. We sometimes use MRIs. It really depends on the situation to really address and make sure that everything is looking great with the uterus and the tubes. And then it comes down to the ovaries. And so testing if someone is ovulating normally, because you need to ovulate every month if you're going to have a chance of getting pregnant. Oftentimes, we don't even need to necessarily do any tests. We just need to talk to you and understand what's going on with your period every single month. But there are tests that we do that are related to ovarian reserve. And so that's that AMH and FSH. FSH is a particular test that has to really get done on day 3 if you're thinking about using it in the context of fertility. Um, FSH is a little tricky in that it's variable, and so it's not the same every month. And so if you were testing it every single month all the time, then it would probably be more useful. But because there's such variability in it from month to month, you can't just assume that if it's normal in January, that in February it's also going to be normal. And so it can sometimes be misleading if you get a low level, which is a good level. It's very helpful when we're on almost the other end of the spectrum and we're working with women that are older in their late 40s and trying to understand if they're perimenopausal. The FSH can be incredible. And it's something that many insurance carriers will require that you have to have that FSH testing. But because of those variabilities, what ends up happening is a lot of doctors have just switched to AMH, and AMH is a really good marker of just telling us what goes on with the ovaries. So it's predictive of what we might see on an ultrasound in terms of number of eggs and also kind of how the follicles, which are the fluid-filled sacs that hold the eggs, how they're going to respond to the medication when we give patients medications for fertility treatment. So we use the AMH in a couple of different ways and indications. And so again, in choosing like how you use the results of those tests to kind of help figure out is the right thing an IUI versus an IVF, you have to look at the big picture. You have to look at, okay, are there issues with the sperm that are going to prevent the sperm from binding to the egg, right? So that's kind of where that sperm QT might come in of like, okay, I'm going to skip the IUI and go directly to IVF, or the numbers of sperm are so low that they're just not high enough that an IUI would work. On the female side, that ovarian reserve is really useful because the ovarian reserve, well, if someone has 10 eggs or 18 eggs, that's probably not going to be making a difference with their success rates with an IUI because an IUI, we're just trying to get a couple of eggs to grow each month. And so it doesn't quite matter if it's exactly 12 or 18 that are available. It does matter greatly for IVF. And so we use that information to say, hey, if you're going to go through an IUI, this is what we think the success rates are. And your ovarian reserve is really critical to what the success rates are going to be in an IVF cycle. It doesn't change the egg quality or embryo quality, but it changes the availability of what we're going to have at the end. How many embryos are we going to have at the end of that cycle for you in terms of what you can use to get pregnant? And then you have to put that all together with what you want as an individual or a couple in terms of how many kids you want, when you want them. And so those are the kinds of things that we use to really make individual decisions for every couple. And it's not even decisions. I don't like to say decisions, it's recommendations. Like my job is to make sure that every patient has all of the information available to them about what their success rates are going to be with the different treatments, how that's going to impact their ability to have this first baby, their future babies. And then it's the patients have agency in this to make their own decisions, decide their own path, right? Because everyone's their financial means are different, their ability emotionally, physically to go through all these treatments is different. And so people are going to choose different options.
And
And
that's
again,
a
like I
great,
think it's, yeah, go
yeah, I was
ahead.
just going to say that's a great segue to the next page, which is kind of how to get started. So we
hmm
have here a list of some of the common tests that are done. We're going to send this presentation around so everyone can revisit it. But obviously, you'll be in incredible hands with someone like Dr. Bendikson and her team who can really help you interpret all of these different results. So let's say I went and got tested. I've actually done several rounds of egg retrievals myself. I now, you know, I'm kind of ready to go, either to get tested or to actually start with my procedures. What's the next thing you would recommend that I would need to know?
Well, I think that you kind of nailed everything right there. It's like you have to kind of understand what the results of all the testing mean. And then understand what options are available to you and maybe what's recommended, what you feel comfortable with, and what your desires are. And then you need to understand the costs of everything, right? So it's kind of just like understanding like what are the side effects of what this all of these treatments are going to be. What is the time commitment of all of these treatments going to be? You have to understand the financial aspect and the impact that is going to be because sometimes you have patients that are like, I only want to do this, but I'm going to do this 10 times. And I'm always thinking, okay, well, what is your plan B? So make sure that you haven't exhausted all of your financial means for your plan A, and you'll have anything left over for plan B. And so I think it's like really getting that big picture. And this is really where Sunfish can come in for those patients who are thinking about that and going to IVF and understanding, okay, how much is this going to cost? And how do I kind of use that to pursue what I want in terms of fertility treatments?
Fantastic. Well, that is a great segue for me to talk a little bit about how Sunfish helps. So, thank you for that overview. We know that this process can be costly financially. I love that you mentioned time and logistics, emotionally. And so, Sunfish is here to work alongside great clinics and be your full system of support. Our team's over 20 people. We're based all over the country. Many of us have been through IVF ourselves, including me. And we designed the IVF Success Program to help support you throughout your fertility journey. I'll talk a little bit about what this all-inclusive bundle includes, but at a high level, it's designed to be very transparent with prices to provide you with support and discounts throughout the process. And so these are just example numbers. If you were to come to a clinic that offers this bundle, you would be able to purchase an all-inclusive bundle that's customized based on your procedures. So if you are doing regular IVF or IVF with an egg donor or reciprocal IVF, it would be a different package. Um, but it's a flat fee for your whole cycle, including unlimited transfers. And everyone can also qualify for a refund, which you can apply as a discount if you do need to try again. Of course, we're going to do everything to help you get pregnant on your very first try. And that includes getting you a lot of discounts and savings throughout the process to try to make it as stress-free as possible. We do also offer loans if you need financing up to $50,000, as well as expert created guides to help you throughout the whole process. We have an incredible medical advisory board that has helped us create guides for each step of the way, very evidence based, to really help you put your best foot forward. And once you do that testing and kind of know what it is you're trying to solve for, you can come up with a very specific treatment plan with your physician at your IVF clinic, and we'll also be there to support along the way. And so each patient who enrolls with this package would get a custom package. You can select from a few different packages. It will include everything at your clinic. And like I mentioned, can be customized for additional retrievals, anything you need added on, sperm donors, egg donors, etc. So compared to paying a la carte, patients can save a good deal. But you're also getting all that support. And we're here for that just in case moment. We know that everyone's goal is to get pregnant on the first cycle, and that's our hope for you as well. But it does sometimes take a few cycles. For me personally, I've actually gone through 4 egg retrievals, and so these financial protections that are part of this package for self-pay patients actually can allow you to keep going. We see that patients who enroll with this package are much more likely to eventually go home with a baby because you're getting that support and can re-enroll just in case. But we're going to all hope that you get pregnant on the very first try. Um, and so, in addition to that financial protection, we will be here to help you every step of the way. We're here providing you those guides. You can text or call us if you have questions. We send care packages throughout the process. And we'll handle all of the payments. So it's basically one and done with your clinic payments. So we really hope we get the chance to work with some of you. This is a testimonial from an actual couple that's worked with Sunfish. Cher and her family were able to really navigate the IVF process with our support alongside their incredible clinic. So with that, how can you learn about this program at Kindbody? So we recently launched this program at Kindbody Los Angeles. So everyone in LA, you are in luck. We are so excited to be working with such an incredible group of providers in LA. You can go to this URL to learn all about the program specific to Kindbody. It takes just a few minutes to get your custom package set up. It's free to get that custom quote, and our team will help answer any questions you have about the process. So, would love to have folks come check us out if you're interested. This is a photo of the Kindbody LA clinic and some of their team. And like I said at the beginning, I've been so impressed with everyone that I've met at the team. I know you'll all be in really great hands if you do move forward with your IVF cycle at Kindbody LA. So, with that, we're getting close to the end of the time. I have some really exciting special offers. If you attended this webinar, you can get a $500 discount on that all-inclusive bundle with this code, as well as 50% off your new patient consultation. You would just have to complete your consultation and enroll before the end of June. So anyone who registered and completes their consultation or enrolls by the end of June would get that discount. I'll email this out, like I said. So these are all the ways to contact us. Dr. Bendikson, it's been so wonderful to hear all of your insight on how folks can learn about testing and get started. Do you have any other closing remarks you'd like to share?
Um, I think I just, in closing, would love to just say that I think that the sunfish option is so incredible for patients. And it's so needed because so many people don't have coverage. And you're absolutely right. As much as we would love it to be that only one IVF cycle is necessary for everyone to have and build their entire family, um, it's just not the case. It's not the case for many, many patients that are having to go through multiple cycles. And so, it's really important to have this available. I think the way you guys have set it up, and this is very specifically why we chose to work with you, um, is that it's just transparent, it's easy, and I think you do a really good job of making sure the patients feel supported and understand what any financial obligation is, and then um, what the terms are on the back end. And that's really important because you can provide the service, and if you're not providing the customer experience along the way, it's going to fall short, right? And so I think that's what we strive for at Kindbody. And I think that that's what you guys are also providing, a really great service in such a great way.
Thank you so much. I really appreciate you saying that, and that really is our goal. We want to be your part of your team alongside your great clinic team, and help you for each step of the process. We know this is a lot to manage, so you need a lot of support behind you to customize and give you that guidance, financial, emotional, administrative throughout every step. We did get one question. I know we're a little over time, but really quickly, someone's asking if you are over 40 and you do egg banking to obtain multiple embryos. I'm guessing you mean you do a couple retrievals. Is each transfer considered a separate attempt? So the way our program works really tactically is you are buying one package. In that package, you can include multiple retrievals if you want. We would adjust the pricing for you. So you could do a two retrieval or three retrieval package to bank those embryos, and then all transfers from that package. So if you got five embryos, all of your transfers would be covered by this program. So it's really flexible. And yeah, I will just echo that. We're so excited to be working with Kindbody Los Angeles. I can't say enough times how much I enjoy going by the office and working with such an incredible, dedicated team that's also really committed to patient access, transparency, and our shared goal of helping you all go home with a baby. So I know I speak for both of us when I say we'd be so honored to help you build your family. I hope we get to work with you. Please reach out. And with that, thank you so much, Dr. Bendikson, for joining.
Well, thanks for having me. I'm just one of many people in LA, just as I know you're just one of many people on our team. We're all working really hard for everybody, right?
We
For that
are.
goal of the goal of that baby, the baby now, baby in the future. Exactly. I love it.
That's right. Oh, and I forgot to say we're both based here in LA and we're both pickleball fans. So maybe you'll find us on the pickleball courts, if not in the office. All right. Thanks, everyone.